Today, we're diving into the fascinating world of blood pressure. You might have heard your doctor mention it, but do you know what it really means? Let's break it down. Blood pressure is a critical physiological parameter that reflects the force exerted by circulating blood on the walls of your blood vessels. This is essential for delivering oxygen and nutrients to your tissues and removing waste products. Blood pressure is measured in millimeters of mercury, or mmHg, and it's expressed as two numbers. The first number is the systolic pressure. This is the pressure in your arteries when your heart contracts and pumps blood out of the left ventricle. It's the higher of the two numbers in a blood pressure reading. The second number is the diastolic pressure. This is the pressure in your arteries when your heart is at rest between beats. It's the lower of the two numbers. For example, if your blood pressure is 120 over 80 millimeter mercury, that means your systolic pressure is 120 millimeter mercury and your diastolic pressure is 80 millimeter mercury. Now, several factors influence your blood pressure. 1. Cardiac output. This is the volume of blood your heart pumps per minute. It's determined by your heart rate and stroke volume, which is the amount of blood pumped with each beat. 2. Blood volume. The total amount of blood circulating in your body. Increased blood volume can raise blood pressure, while decreased blood volume can lower it. 3. Peripheral resistance. This is the resistance of your blood vessels to blood flow. It depends on the diameter and elasticity of your arteries and arterioles. Narrow or stiff arteries increase resistance and, consequently, blood pressure. 4. Blood viscosity. The thickness or stickiness of your blood. Higher viscosity increases resistance and blood pressure. Your body maintains blood pressure within a normal range through several mechanisms. 1. Baroreceptors. These are stretch-sensitive receptors in the walls of your carotid arteries and the aorta. They detect changes in blood pressure and send signals to your brainstem, which then adjusts your heart rate, cardiac output, and blood vessel diameter to stabilize blood pressure. 2. Renin-angiotensin-aldosterone system, or RAAS. This hormone system plays a crucial role in regulating blood pressure and fluid balance. When blood pressure drops, your kidneys release renin, which triggers a chain reaction leading to the production of angiotensin II. Angiotensin II causes blood vessels to constrict and stimulates the release of aldosterone, which promotes sodium and water retention by the kidneys, increasing blood volume and blood pressure. 3. Nervous system. The autonomic nervous system regulates blood pressure through the sympathetic and parasympathetic nervous systems. The sympathetic nervous system increases heart rate and contractility and causes vasoconstriction, raising blood pressure. The parasympathetic nervous system promotes vasodilation and lowers heart rate and blood pressure. 4. Hormones. Various hormones influence blood pressure. For example, epinephrine and norepinephrine increase heart rate and cause vasoconstriction, raising blood pressure. Antidiuretic hormone, ADH, promotes water reabsorption by the kidneys, increasing blood volume and pressure. Atrial natriuretic peptide, ANP, promotes sodium and water excretion by the kidneys, reducing blood volume and pressure. Maintaining your blood pressure within a normal range is crucial for your health. Abnormal blood pressure levels can lead to various health issues. Hypertension, high blood pressure. Chronic hypertension can damage blood vessels and organs, leading to complications such as heart disease, stroke, kidney disease, and vision loss. Risk factors for hypertension include obesity, a sedentary lifestyle, high salt intake, stress, smoking, and genetic predisposition. Hypotension, low blood pressure. Chronic hypotension can cause dizziness, fainting, and inadequate blood flow to organs, leading to conditions such as shock. Causes of hypotension include dehydration, heart problems, endocrine disorders, severe infection, septicemia, and blood loss. Measuring your blood pressure is simple. You use a device called a sphygmomanometer. Here's how it works. Wrap an inflatable cuff around your upper arm. Inflate the cuff to temporarily stop blood flow in the artery. Gradually deflate the cuff while listening with a stethoscope or using an automated device to detect blood flow sounds. The first appearance of sounds as the cuff deflates indicates the systolic pressure, while the disappearance of sounds indicates the diastolic pressure. Certain lifestyle modifications can help manage your blood pressure. 1. Diet. A healthy diet low in salt, saturated fats, and cholesterol, and rich in fruits, vegetables, whole grains, and lean proteins can help maintain normal blood pressure. 2. Exercise. Regular physical activity strengthens your heart and improves blood circulation, helping to lower blood pressure. 3. Weight management. Maintaining a healthy weight reduces strain on your heart and blood vessels. 4. Stress management. Reducing stress through relaxation techniques such as meditation, yoga, and deep breathing can help lower blood pressure. 5. Avoiding tobacco and limiting alcohol. Smoking and excessive alcohol consumption can raise blood pressure and harm your cardiovascular health. Blood pressure is a vital indicator of cardiovascular health. Understanding how it works helps in its effective management and prevention of related health issues. Thanks for watching. If you found this video helpful, give it a thumbs up, and don't forget to subscribe for more health tips. See you next time.